heart disease, diabetes, tobacco use. Those are just a few examples of health inequities within the African American community. So, what does UC Davis School of Medicine, SAC Cultural Hub Media Company, and Sierra Health Foundation all have in common? The common goal of connecting physicians who are reducing those disparities within the urban community. Well,
I think what's so awesome is that Plachette and many folks have been working on convening our black physicians. This is our third year we've been able to do it. We have over 200 physicians from Northern California that are here, and we all know that the African American community, when it comes to heart conditions and blood pressure and diabetes, our risk level is at the top. Yeah. And a lot of things can be corrected if we just have awareness and do prevention and get educated properly, and that's what this is really about.
Hello, we're here at the Black Physicians Forum talking with Dr. Wesley Clark about the Adult Use Marijuana Act and the impact of it passing in California on the health of African Americans.
What we can predict is that there will probably be an uptick in use by young adults and some of the diffusion of that use into adolescents. How is that going to impact the health of individuals? Depending upon the level of use, depending upon the factors associated with that use, whether the person is using other substances, whether the person has psychological issues like depression, psychosis, and the use may precipitate some other complications.
Okay, I'm standing here with Dr. Yinka Davis. Thank you so much for joining us this evening. Now, what do you feel is the key role of African American physicians today when seeing and treating African American patients?
And particularly for me, it's obesity. So as a pediatric gastroenterologist, I deal with this on a daily basis. And seeing the kids coming in and seeing our children that are actually now 40% prevalence of obesity amongst African American children is a place where I think I can actually do some prevention and some education towards our kids.
Hi, I'm Dr. Valerie Yerger. I'm a naturopathic doctor and a assistant professor in health policy at the University of California at San Francisco. So during the last several years, I've gathered quite a bit of expertise observing how it is that the tobacco industry systematically targets African American communities.
We're excited to be here tonight at the Black Physicians Forum 2018. We're here with Dr. Carl Hart, and we're welcoming you this evening.
I'm happy to be here. Thank you for having me.
Really glad that you're able to join us. We are here tonight to talk about modern day drug addiction in relation to health and poverty in the African American community. Can you tell us a little bit about your history with studying drug addiction and what you're working on now?
Yeah, I've been studying drug addiction about 30 years, actually about 25 years, and I started out studying drug addiction in part because of those issues that you just named, mainly because of my concern about drug addiction in the black community. But then over the course of this sort of 25-year career, I discovered that drug addiction is not really a big deal in the African American community. There are far more other important issues like employment or unemployment, education, racial discrimination. All of those things become far more important than drug addiction. And what drug addiction becomes is a distraction for people not to deal with the issues that I just told you about. So it took me damn near 20, 25 years to come to this position, but that's where I'm at now.